Yeah. Got it. Thank you, Ana Mele. Ana Mele is in there twice also. Leticia. This is wonderful.
Hello.
Hello, everyone. Hey, Leticia. Leticia.
Leticia.
Hi.
Hi, Leticia. How are you?
Hola, Leti.
Hey. Yeah, when you
So
come in,
nice
everybody,
to
please
see everyone together.
put your cameras on in the beginning if you could, please, so we can see everybody and wave. See a lot of familiar faces. Hi.
Hey, Ana.
Hola. Hello. Greetings,
Hola, Ana.
everyone.
Qué bueno verte, Ana. Ana María.
Ana Maria.
María.
Hola, Ana
Ah.
María.
Hi.
Hola, ¿cómo están?
Wow,
Hola.
it's great to see everyone. Well, let me see. Hi, Maria Cristina Hoyos. Hello, Maria Cristina. Let me see, Maria Cristina joining us from Colombia. We have people joining us from at least 3 different continents. Hello. Hello, hola. And Jose Francisco. All right. Hey, Jose Francisco. I think for all of those who have joined on time, what I think we'll do, we'll go ahead and begin, and I'll give a brief introduction. But first of all, I want to say welcome and thank you for everybody participating in this webinar on our HRH interns. Where are they now? You can wave to everybody. It's so great to see your faces.
Hello, Jose.
Hey. Well,
Hola, Jose Francisco.
Hey.
Hola a todos.
Hola. You all have time to talk, don't worry. So I'm Karen Gladbach. I think most of you know me. I'm from the Human Resources for Health team, and I manage the internship program. We see a lot of familiar names and faces, and if everybody can put on right now, put on your cameras. During this session, I'm going to ask you to turn them off, and we'll just keep on the panelists, but for right now. We have over about 20 former interns that had signed up for today, and also some PAHO supervisors and former PAHO staff that are here joining us today for this internship webinar. It's really great to see all of you. I think you know how much we value this program, and we appreciate the work that you have done for PAHO. And so we really wanted to bring you all together to highlight some of the work that you've been doing. The purpose of the webinar is twofold. We want to demonstrate the value of the internship program and by hearing your stories, and also to develop and nurture a network of former HRH interns so that you can be a resource for each other and also for PAHO. So today we have a panel of 4 former interns who worked at PAHO in the HRH team over the past 5 years. And in a little bit, they're going to be sharing their stories about the internship experience at PAHO and its influence on where they are today. So the first half of the webinar, we're going to focus on the panelists and asking them questions. Following that, we'll have a brief presentation on the actual internship program. Then we're going to open it up to Q&A, and I'm going to ask you all then to turn your cameras back on, and you can ask questions of whoever. You can have a conversation. We can hear from supervisors if they'd like about any of their comments. And then we'll close with a look at the LinkedIn page that's been created so that you all can have a means to communicate with one another. So what I will do right before everybody leaves, I'm going to ask everyone to turn their camera on. Carlos, hello. Carlos and Sarah and Maria, just one time before we head out. Good to see everybody.
Could take a picture, Karen.
You're doing that?
I can do it if you want.
Okay, and Bruna
What's
said
that?
she's going to, afterwards we'll send you a picture, and this is being taped. Ana Maria, I don't see you. Okay. Whoops, all right, there you are, okay. You were covered on purpose. All right.
Should we take the picture? Is Bruna taking the picture?
I'm taking.
Okay. Got it? Smile? All right. So now I'll ask everybody to turn their cameras off except for the panelists, myself, and also please turn off your mics. And what we're going to focus on right now is the actual panel. So as I mentioned, we have 4 panelists, 4 former interns that are joining us, and they were selected obviously because of the impressive work that they're doing, and also because we wanted to show the diversity of the program and the interns that we have, coming from different countries, different regions, coming from different areas of study, different PAHO, working with different PAHO supervisors in different areas. And they've taken different paths in their work. Some are in academia, in a multilateral agency, private agency, clinical work. And also, this is representative of the gender situation within health workforce. On our panel, we have 1 male. And so as women making up 80% of the workforce in health, that represents it. So I'm going to start by asking the former interns, our panel, to introduce themselves. And basically, they're going to share with us in the beginning just where they're joining us from today, what they study. They can share that with us too, and where and when they worked at PAHO and with whom, and where they're working now. So a brief introduction before we get into the details about their internship and the current work. So what I'll do is I'll start with the intern. I'll do it in chronological. The first intern that worked with us that's on the panel in 2017, it's Samantha Brown. So Sam?
Sure. Hi, everyone. Thank you so much, Karen. I'm so excited to be here and see familiar faces. I'm Samantha Brown. I interned at PAHO in the summer and fall of 2017. So I was in the process of earning my Master's of Public Health, concentrating in epidemiology at George Washington University, which was right down the street. I worked with Anela Auer with the Edmundo Granda Ugalde Leaders in International Health Program. I currently work and live in Washington, D.C. I work for a nonprofit as a research analyst. The nonprofit is called the Center for Construction Research and Training. So we do different epidemiological activities. We conduct surveillance. We do some research around issues impacting construction worker safety and health.
Thanks, Sam.
Thanks.
Thanks, Sam. And now on to our next in chronological order. In 2018, PAHO, we were joined by Chiara de Aire. So Chiara.
Hi, Karen. Thank you so much for inviting me today. It's definitely a pleasure to see so many familiar names and faces. So yes, my name is Chiara de Aire, and I was working in 2018 from February to August. I had the pleasure to be able to join 2 different offices. First, I was in Panama at the country office, where the virtual campus of public health is based, which is where I was doing, which was the focus of my internship. And then 3 more months in Washington, D.C. at the headquarters, and with Gabriel Listovsky as my first supervisor, and then continuing working with the campus, as well as working with Karen in D.C. Yeah, so now I actually joined PAHO right after finishing my master's in global health, which I did in Denmark, but partially with a semester abroad at George Washington University. So Samantha, we are kind of connected that way. And yes, I'm working at the World Bank.
Okay. Thanks, Chiara. And Chiara's was a unique experience because it was one of the first times that we had an intern that worked in 2 different sites in one of our offices at PAHO, and found that to be really beneficial. So thanks, Chiara. Now we'll move on to later in 2018. There was a little bit of an overlap with Ignacio Saez Perot, and he is joining us here today from Argentina. Ignacio. Ignacio, it looks like you're on mute. He's joining us from the hospital where he's actually taking a break from work. Ignacio, if you want, is it working? Because what I can do is I can ask Nayori to go first, and maybe I'll ask Nayori to go first and you find somebody that can help you. Perfect. All right, Narian, and then we have who was joined us in 2019, Maria Narian Fernandez, who's joining us today from Brazil. Narian. Nari.
Thanks very much for having me here today. It's a great pleasure to be with you, with Karen, and with all familiar faces I'm seeing now. I feel like home. So I'm Narian. I'm a nurse professional. I was at PAHO from January to May 2019. My supervisor was Dr. Silvia Cassiani. My area was nursing and interprofessional collaboration in nursing. And right now I'm living in Brazil, Northeast, working as a psychiatric nursing professor at Federal University of Maranhão. Thanks.
Thank you. Thank you, Neri. Thank you.
Can you hear there?
We can now, Ignacio. We can hear you very well.
Perfect, perfect. Thank you. Gracias. So my name is Ignacio Sáez Perrota. I was in PAHO right after Chiara in HRH. I worked, my supervisor was Jose Francisco, that's here today. So it's very good to see my mentor. I learned so much from him. And well, now I'm working, I came back to my country to study my master's. I'm doing the master's in clinical effectiveness and health management. And currently I'm working for Garrahan Children's Hospital. I'm a fellow in ambulatory medicine.
Okay, all right. Thank you. Thank you, Ignacio. Before we begin the questions, I'm gonna ask a question of all of you, of the participants, to type in the chat where you're joining us from today and what you studied in school or what your area of experience and expertise is. So just type in the chat. We want to just see the folks that are joining us. Anybody? We see, there they are. Hey, Leticia, Rockville, Maryland, United States, Imani from Paris, Paulina in San Antonio. And Sara, and just to give you an idea of the variety of people that where they're coming from. What I'm going to ask of you right now is we're going to focus first on, keep on writing it in there. We'll have this in the chat so we know who's joining us. We're going to focus first on your time at PAHO. And I'm going to ask you to tell us about your work experience at PAHO, some of the highlights of the experience for you, of what you gained from it. And we'll start with, we're going to go in reverse chronological order now, and with the person who was most recently there, which on site, which is Neri. Neri?
Yes. So when I was at PAHO, I collaborated in the organization of the International Nurses Day, held in May 2019 with Dr. Cassiani. And I participate in improving exchange of information between member states and PAHO related to nursing and allied professionals issues. I was part of the authorship of a letter to the editor of the Pan American Journal of Public Health, which was a great experience for me, writing and deal with that process. And finally, I developed a protocol for a systematic review of the literature titled Skill Mix of Nurses and Primary Health Care. And I had the opportunity that after my internship, I could perform that research and publish that paper. So those were my most important experiences at PAHO.
Thank you, Neri. I think your experiences and those of the others will show that there really are products and deliverables that the interns work on through the experience. Let's go back. How about you, Ignacio? On your time at PAHO and your
Yeah.
work experience.
So my work experience in PAHO was life changing, as I wrote you when you contacted me. I specifically worked with Jose Francisco in Human Resources for Health. And what we did was working especially with universities from all of the Americas to promote areas of primary care as areas of education. All medical schools always are looking for super hospitals, complexity, cancer, transplantation, but all what's rural areas or primary care environments were left aside. So as a strategy to get health workers to rural areas and areas where people usually don't want to work, the Pan American Health Organization has a program for that. And that's what I worked specifically. But on the other side, I had the chance to explore a little bit around the organization and my stance there in Washington. I had the joy of being in a directing council. I could explore other areas of interest. So it's not that I just went there to do something very specifically, but I had the chance to explore the organization, to get to other offices, and we also organized a webinar for health of immigrants, directing councils, and I could explore, I could speak with people from other areas that could give me advices for my career in public health that I'm actually doing now. So it was super rewarding. It wasn't just that I went there for one thing. I think that the internship, it's not just going there to something specific, but it's very good to explore, because there are many things that you can find there. And I had a really great experience there.
Thank you, Ignacio. I think you're right. The different meetings and programs beyond the actual internship and working with the supervisor enrich the experience. And Kiara, how about? Thank you. And Kiara, you want to share your story about PAHO, your internship experience?
As I was saying earlier, my focus was very much on the virtual campus public health, but as Ignacio said, at PAHO, you get to experience many other things as well. Overall, the main goal of my internship was to develop, assist, and finalize virtual learning courses for the virtual campus of public health. And I'm also getting to experience how PAHO works, both at the country level and the regional office level, and to strengthen my Spanish skills, which I think I can definitely proudly say I achieved all of my goals very successfully. I've developed a virtual course from start to finish on the Sustainable Development Goals in the context of Panama specifically. I also provide assistance to review, finalize, launch different courses on different topics, including research guidelines and social missions. I see, since Jose Francisco is here, definitely have to give him a shout out. And many other courses that I provided feedback or assistance on. And then I also supported the operations of the virtual campus through many different small tasks. And then I also really had the chance, since I was in the field in Panama, to experience a little bit more the country office there. I took part to a field trip where we went to an indigenous area, a comarca in Panama, and where we kind of assessed the access to healthcare and the state of available resources for health, and was able to interview members of the community and get some content for my course as well. And also took part to the coordination organization of a World Health Day event in Panama. And then at the regional office, I also got to experience a lot of how things work there, take part to important meetings, including the executive committee sessions.
Thank you, Kiara. Just amazing. If you look at each of you worked at PAHO, I believe about 6 months, between 4 and 6 months, and the deliverables, the products that you were involved in, really impressive. And Sam, your experience at PAHO.
Sure. So I worked, my primary task was to help with the implementation and evaluation of the Leaders in International Health program. So that's basically a training program targeting health professionals in different sectors, so medical workers, researchers, government or policy workers, et cetera, to address basically complex international health issues in the region of the Americas. And as someone coming from a background of very quantitative research and epidemiology, it was very interesting for me to be exposed to the context behind a lot of these health issues that we're looking at. So I did things like literature searches. I attended the virtual modules, the virtual trainings. I helped a little bit with interpretation, Spanish interpretation of PowerPoints and chat, things like that during the session. So I also really improved my Spanish during my time at PAHO, which I'm very thankful for. And then I also was able to help with some unplanned tasks that were actually very helpful for my professional development. I met a consultant, Amelia Brandt, who worked with Dr. Castiani and doing some research related to maternal health training needs. So we did a couple of needs assessments and ended up publishing manuscripts in the Pan American Journal of Public Health. So all of those were really valuable experiences for me.
Thank you, Sam. I think you had a key phrase there, unplanned experiences. And I think that happens a lot at PAHO, in any job, but especially at PAHO. And we really appreciated the flexibility of interns to support us and work on those activities. So that's your experience at PAHO. And now I'm going to take us to today and what you're doing today in your current job. And if you can reflect on how the PAHO experience has influenced your work today. And on that one, why don't I start with you, Chiara?
Yes, sure. So right now I'm an extended term consultant at the World Bank. My title is Research Project Manager and Analyst. I'm specifically in charge of leading data collection efforts, supervising field work, analyzing data, and writing reports and academic papers for various impact evaluations of global health research projects, mostly in sub-Saharan Africa. And I'm focusing especially on malnutrition prevention and reduction. I should mention, I was already working as a consultant at the World Bank before my PAHO interview. I realized I'm running out of charge. But I was pretty much doing just very small data cleaning, past couple of hours a week, very, very little work. And so after my internship ended, and kind of throughout my PAHO journey, I evolved from being like pretty much a student fresh off my master's with very little professional experience to working in a major international organization, being exposed to both the country PAHO office and the regional office and how these function and interact with each other. And I got to obviously deepen my understanding of important global health priorities and kind of how to translate the knowledge that I'd acquired during my studies into practice. And in addition to some really great skills that I learned, including hard skills as well, and field experiences. And so all of these combined made me a much more attractive candidate by the time that my internship was over, and especially for international organizations. And the World Bank actually immediately offered me a very competitive contract to hire me full-time after my internship was over, to make sure that I wouldn't go anywhere else. So now my work involves a lot of things that kind of tie with how my internship at PAHO went, or little things that definitely was able to translate from my experience at PAHO. For example, my tutoring and teaching skills that I learned very much working in the virtual campus, I've been using them so much to develop training materials and deliver trainings for large teams of data collectors in the field. And now that COVID has made traveling much more difficult, virtual learning is definitely extremely important. Also, I've recently been included in a team of evaluators to review an online course to optimize government budget allocation to alleviate malnutrition and child mortality. And so my knowledge of virtual courses and how to kind of make them more interactive and interesting and engaging with the users, again, has turned out to be super useful. anytime there is a Spanish speaking task or whenever the Latin American context comes up, I'm first to be called by my team. I've literally been called to meetings to like translate questions from Spanish speaking participants. And overall, PAHO has been part of my journey very much. And obviously the journey hasn't ended. I actually recently applied for a PhD that was in Latin America in Spanish and been a virtual learning tool. And I actually got the offer, but I refused it for another year at the World Bank. But if it wasn't for PAHO, I would have never learned those great skills. And obviously it's still very much within my field of interest. I guess that's all for me about my current journey. We'll see about the future.
Thanks, Chiara. That's exciting. I didn't know about the PhD opportunity. Good luck on that. Now let's move to Neri in Brazil. Neri.
Yes, sure. Right now, I'm working in teaching and doing research on mental health and public health in Brazil. I'm developing some research projects on students' mental health to promote institutional policies for well-being of university students. Also, in the beginning of the year, I surveyed the nurses' mental health conditions to plan some mental health interventions to the nurses of the town where I work, that is Imperatriz in Maranhão, to help them to cope with the burnout and stress related to work, mainly during those COVID time. And PAHO gave me the high support on improving my research skills. And I work with Cassiani and Dr. Ludovic, to write one systematic review, and that helped me to improve and to be more curious to do more research. And PAHO also upgrade my public speeches through Toastmasters Club, and I'm still today a member. And also it helped me to build up my leadership skills profile. So now I'm kind of a reference, and also PAHO gave me that strength. It's like people give me more, they say, oh, she's from PAHO, so she's a good professional. So we can look after her and ask her opinion. And I feel more strength as a professional now, and I can feel like PAHO is important to my career right now. And also, I remember when I was about to end my internship time at PAHO, Dr. Cassiani talked to me about my experience with her. And then she told me that I would have some difficulty to go back to my work. And I say, okay, I will see that. And in the end, she was right. It was really difficult for me to fit again in the same place. And I had to think and to reflect about that feeling that I had. And then I learned that that feeling is normal. And it was good because I realized that after PAHO experience, I became more a citizen of the world. So now I can be more related to my place where I work, but also to be abroad, to have contact with other researchers and doing more research with international partnership. So I think that was a great legacy from PAHO to my my experience as a professional and as a person, to feel like a citizen of the world.
Thank you, Neri. I think you just demonstrated also the value of the work of the supervisor. It's not just hard skills. It's learning much more beyond that. So kudos to Dr. Kassiani. And now let's move to Sam, about your current experience.
Sure. So I currently work as a research analyst with the Center for Construction Research and Training, which is a nonprofit. We focus on safety and health issues related to construction workers in the US. So we look at things like injuries, of course, non-fatal and fatal injuries, but we also look at other things like COVID-19 related issues, mental health and substance use issues, especially opioid use. And I think my experience with PAHO really helped me in two main ways. The first one is very similar to what I think Nuriam was saying, in that I felt more like a kind of like a citizen of the world. I was able to contextualize a lot of the other research or projects or data that I was analyzing in the context of larger economic and you know, like socio-political factors, because it all kind of goes together, and that knowledge was really valuable to me, or that way of thinking was really valuable to me in my current work. So for example, in the US, 30% of the construction workforce is Hispanic, and many of those people are immigrants from the region of the Americas, in particular Mexico, and we see a lot of health disparities in the workforce. And I think my work at PAHO helps me to think about, you know, why that is, and then we can incorporate it into our research and ask the broader questions of, you know, how can we address this not just through workplace interventions, but also through things like regulations and policy. And because if my background were strictly quantitative, and if I were at PAHO just analyzing data sets like I've done in some of my other work, I wouldn't have had that experience. So I think that was really valuable to me, especially through the international lens. And then a second way it was valuable to me was I was able to co-author my first academic publications. So I was so excited to be able to work in an unplanned way on academic manuscripts and publish in the Pan American Journal of Public Health. I wasn't expecting that opportunity, and I think it just, it was valuable to see how the process worked, but it also triggered a lot of my excitement about the field, and it gave me a lot of momentum to keep moving forward in public health research.
Thank you. Thanks, Sam. I'm going to end this question with Ignacio.
So, well, if I have to say what I'm doing today, I'm studying very hard, I have to say. I'm doing my master's in, as I said, in clinical effectiveness, health management, and health technology assessment in the public health of the University of Buenos Aires. That's because I went to PAHO and I spoke to the right people who made me get the right program. And I'm doing the fellow in ambulatory medicine because I can't leave this thing. There is something with this that I just can't leave it aside. But well, when I got back from DC, I was finishing the residency in pediatrics. I'm a pediatrician, and I got chosen to be head of residents. So I had 100 residents in charge, and our program did not include anything about primary care. So I started working to develop a program of primary care for our residency. It was really, really hard because to do that, I had to change the mind of the people that were in charge, because they wanted our residents to be 100% in the hospital and not in the areas. So I had to walk all over slums of Buenos Aires, rural areas of Argentina, to get to find the places, the right places, establish a program, get the people, and finally we made it. And now 100 residents of Posadas National Hospital are all around the country, everywhere, in Chaco province and Luis province, in the slums of Buenos Aires. And they have a mandatory, they have to go for 6 months to those areas to do the work for primary care. And that was something that if I didn't go to PAHO, I wouldn't have thought about that. And at the beginning, even the residents did not like the idea, but then they started thinking, no, but this is what's pediatrics. This is pediatrics, not like transplantation and cancer and intensive care units. So especially that was like the most important thing that I got from my experience in PAHO that made me on my day-to-day work. And then the pandemic came, and I had to stay in the same place. And well, finally, when I finished the residency, well, now I'm studying. I keep studying. I will probably join the academic team of the Public Health School of the University of Buenos Aires by next year when I finish my master's. And nowadays I'm still working it's a third level hospital. Garrahan's Hospital is a very important hospital of pediatrics here in Argentina. But well, I'm doing kind of something hybrid. I still can't leave like attention. I still can't leave like the hospital.
Thank you, Ignacio. Appreciate all of you sharing that. It really shows the impact of the work that you did at PAHO and how it's influenced you today. So thanks very much. I have some more questions, but what I'm going to do is hold on those until we have the Q&A time and move on to just a brief presentation that one of our former interns, who is now a consultant, is going to give, Bruna Moreno Diaz, who is going to share with you about the internship program. And one of our previous interns, Dr. Andrea Cabral, who is with us today, had done a survey, which many of you probably participated in. And so some of the results of that survey are going to be presented by Bruna as well. And just one last comment, Bruna was a part of the coordinating committee that helped to put this internship webinar together that also included Imane Zidi and Guillermo Rodriguez, who's with us today. So Bruna, go ahead and introduce yourself and please give a few minutes of the presentation.
Okay,
Thank you.
Just start the presentation. Okay, can you see the screen?
Yes.
Great. So thanks, Karen. My name is Bruna Moreno Diaz. I'm a nurse from Brazil, and I'm also a PhD student at the University of São Paulo. 1 year ago, I started the internship program at PAHO, working with Dr. Silvia Cassiani, to whom I really thank for all the learning and all the opportunities. And after finishing the internship, I started to work as a consultant, as Karen mentioned. So the purpose of the brief presentation that I will show you now is talk about some data that we have about the internship program at the unit. In the slides, as you can see, we have some photos provided by Karen, which shows some interns working with the PAHO team. And before I started, I really want to thank Karen for sharing the data and helping with the analysis, and also for all her support at the internship program. So moving to the data, we have records of 109 interns by May this year. And it's important to highlight that the internship program at PAHO started as an initiative of the unit, at the HRH unit. At the start in 2003, the students are hired by the department from the local universities. And the initiative was expanded, and now the unit can hire other students, other professionals. As you can see in the chart, we have a large number in 2014 because this year the PAHO research team under the supervision of Dr. Luis Gabriel Cuervo was in the unit, but since a reorganization, this research team is not part of the unit anymore. If we look where the interns come from, we have about 86% of the interns from the Americas region and about 46% from North America and 40% from South America. But as you are aware, we also have interns from Europe and Asia. Of the countries, most of the interns are from the USA, followed by Brazil and Canada. moving to Interns Profile, at the start of the program, the average age was 30.9, and it ranged from 21 to 68 years. And 54% of the interns had or were working on a master's degree at the start of the program. The program lasts almost 4 months, and the average workload is 35 hours per week, since some interns were working from 20 or 40 hours per week. The supervisors, we have Silvia Cassiani, Karen Gladbeck, and Luis Gabriel Cuervo, with the most frequent supervisors. They have almost 63% of the interns, but as you can see, we have supervisors working in different areas, such as nursing, medical education, and other topics related to the health workforce. And about the survey that Karen had talked, it was carried out by Andrea Cabral, that is here in this photo and also here with us. This is the last point that I would like to share with you today as the result of the survey that was applied in a sample of 31 interns from 2015 to 2019. And on the screen, you can see the main results obtained, but I would like to emphasize that the program plays an important role in the knowledge of international public health topics, and also in the development of specific skills. The results, we can understood by the results, the interns show us that they can understand better new fields of working or new possibilities to improve the healthcare system. So this is a brief characterization and a brief profile of the interns, some results of the program. That's an important program. And I would thank you for your attention and also for all the great job that interns have been done at the organization. Thank you.
Thank you, Bruna. Thank you very much. So you can see we've had 109 interns over the past 17 years and really have benefited so much from this experience. And now what I want to do, I see Gabrielle's joined us, a few other people have joined us. I'm going to ask everyone to go ahead and put on your camera, if you please. And we're going to open up the floor now to Q&A. And since we're not a large group, we're going to actually ask you to go ahead and raise your hand if you have a question or you want to make a comment. And I'd be happy to hear from any supervisor if they want to make a comment. I'll ask everybody to keep them short so that everyone has an opportunity that wants to speak, but we have about 10 minutes open now. And I'm going to just check to see the hands raised. Let me see. Imane, can you help me on this? I can't, I'm having trouble on my screen.
We have Jose Francisco who wants to speak.
Great. Jose Francisco, please.
Ok. Voy a hablar en Spanglish.
Sí.
Un cacho en español, un cacho en inglés.
Sí.
El portuñol lo vamos a dejar durante un ratito, que ya tendrán oportunidades las Cassiani. Y bueno, a ver, que es un enorme placer estar aquí y veros a todos y a todas. Quiero hacer 4 comentarios muy rápidos para dar tiempo a que otros también comenten, pero también un poquito para poner un poquito de picante a la reunión. ¿De acuerdo? Entonces, lo primero es que acabo de darme cuenta que, de acuerdo que hay un virus circulando, pero hay una enfermedad que se llama salud pública, y que habéis sido totalmente contaminados. Entonces, os deseo suerte en la vida, porque aquí no hay dinero ni fama, aunque Fauci exista. ¿De acuerdo? Eso era lo primero. Eso es una una gran oportunidad de verlo. Lo segundo, que aparte del trabajo beyond the technical work that you were doing with us, you brought us a lot of happiness and fresh air. And this is something that is extremely important for an organization like ours, that is a bit stuffy in many ways, even if you don't want to comment on that. And you are so polite and so nice that only tell us the good things that you got, okay? But creo que es sumamente importante, y aquí quiero también dar y hacer honor a Karen y al equipo que durante muchos años ha mantenido este programa. Porque lo que habéis estado contando y otros internos también nos han contado, forma parte del proceso de selección. Vosotros no habéis llegado a la OPS solamente por casualidad, sino también porque esto ha seguido un enorme proceso de selección que un equipo ha hecho, y por eso los que nos hemos beneficiado estamos tan contentos de haber tenido la oportunidad de teneros a todos aquí. Deciros que estoy muy contento, como me imagino que el resto, de que da la sensación de que a todos os va muy bien. Y eso es una gran alegría, sobre todo porque aparte del trabajo técnico, una parte importante que yo creo que todos los tutores hacíamos era proselytes and evangelization, o whatever it says in English. Era un proceso de evangelización sobre el futuro de las instituciones internacionales que, como sabéis, en este momento están en un cruce de caminos. Y este es el mensaje importante que quiero daros en esta reunión. El futuro de lo que se ha llamado salud global, que es un término que a mí nunca me ha gustado, y el futuro de las organizaciones internacionales, en un momento crítico que se está viviendo, está en las manos de gente como vosotros, no de gente como nosotros que estamos de salida. Y os deseo mucha suerte y mucha fuerza, sobre todo porque cada vez más el filantrocapitalismo, que aquel que no haya estudiado este término, yo os invito a que empecéis a pensar alrededor de él, amenaza claramente la idea de lo que fueron el inicio de las organizaciones internacionales y los intereses público-privados, etcétera, 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 que se mueven alrededor. Muchísimas gracias a todos, es un enorme placer estar aquí y mucha suerte y mucha fuerza.
Thank you, Jose Francisco. And I do want to give a thank you to all of the supervisors and PAHO staff that are here that really make this program, because if it weren't for you either, we wouldn't be able to have the interns. And I know it takes a lot of time. It's definitely worth it, but it is an investment. It's an investment that we believe in. Are there any? I have some other questions, but Imani,
may I say something, Karen?
Yes, please, Sylvia.
Yo quiero también complementar lo que José Francisco decía, ¿no? Y decir que más de que todo, aprendemos mucho con ustedes, ¿no? Quizás aprendemos mucho más do que les damos, ¿no? Aprendemos habilidades, me acuerdo de toda la tecnología de Sabrina, de Bruna, ¿no? De enseñar así muchas cosas que nuestra generación, ¿no? Ya no fue tan acostumbrada a usar como es la generación de ustedes, ¿no? Así con la facilidad y todo. Creo que para ustedes el uso del idioma, ¿no? De tantos idiomas al mismo tiempo, que eso para mí fue muy raro cuando llegué a la OPS, ¿no? Escuchar así como hablamos, ¿no? Ese idioma que ya no es el idioma más nativo nuestro, ya no es más portugués, ya no es más español y ya no es más inglés, y es todo junto al mismo tiempo. Entonces, eso creo que fue una oportunidad. Y también la cultura, no tanto la cultura organizacional, pero es una organización que tiene varias culturas, ¿no? Y cómo trabajar con cada uno, con toda esa experiencia anterior que tiene. Ahora estamos viviendo un otro momento que es no más la presencia física, ¿no? Y creo que eso fue muy importante para muchos, ¿no? Tener así, discutir durante el momento que tomábamos café o hablar sobre algo distinto de la pasantía, de la UPS, almorzar juntos o tomar un café. Eso desafortunadamente ya no hacemos más, ¿no? Y la mayoría de los internos están virtualmente, ¿no? Entonces espero que en un futuro próximo logremos ahí tener la presencia. Y quería decir que para el programa de enfermería, y cuando digo programa de enfermería, digo básicamente yo, porque no hay otra persona ahí, ¿no? Tener internos y tener personal que pudiese trabajar junto era imprescindible. No lograríamos hacer todo lo que fue hecho sin la presencia de los internos y creo que eso debe continuar un poco más porque de verdad que es la presencia de todos que da la fuerza al trabajo. Quero agradecer aqui, uma vez mais, Ana Maria Paulino, Karen, por todo o suporte ao trabalho e desde a OPS também ao trabalho hecho. E estava segura e continuo segura que esse é um programa ímpar em la organização. Todos que salen, como Nerian dijo, no são os mesmos que entraram. E assim como passa com os outros, cada vez que cada um se va, não? Já aprendemos tanto que temos que, e isso vai incorporando muito mais. E ter essa presença, como disse José Francisco, jovem na organização é fundamental. Eu sou a que tenho que agradecer a todos que estiveram comigo. Não recebi agradecimento, mas eu sou quem devo agradecer. Gracias, Karen.
Thank you, Sylvia. I will say, yes, I was going to say it later, but I'll say it now. It's the enthusiasm, the positive energy, the ideas, and the youth. I think when we brought interns on, we lowered the median age of PAHO to like 35 because there's a lot of older people, and it's good to have the youth. So we really, but we're not into ages, and we invite everyone to be an intern or volunteer. It looks like we have Gabrielle to make a comment. Gabrielle Istovsky, another supervisor that many of you know.
Gracias, Karen. Un saludo para todos y todas. Disculpen que no pude estar desde el inicio. A ver, me sumo a las palabras de José Francisco y de Silvia. No sé si ya estuvieron por acá conversando algo Edgardo de Gracia y Carlos León del equipo del campus que también están en la reunión. A ver, 2 o 3 cosas que a mí me gustaría incluir. Desde la perspectiva de la educación, yo creo que no hay nada más rico que programas como estos. Si hay algo que yo valoro en mi historia es todas aquellas situaciones en donde eso que estaba estudiando en la universidad lo podía discutir en el lugar de la práctica. Y por otro lado, nada más importante, y espero que los colegas y las colegas que pasaron por la experiencia de estas experiencias vuelvan a las maestrías, vuelvan a sus universidades y discutan y pregunten y analicen qué es lo que hacemos, cómo lo hacemos. Creo que esto es un valor fundamental de estas experiencias y yo quisiera reconocer que la organización lo esté haciendo, apostar a que continúe haciéndose. Así que me parece que esto es central. Yendo a la vida cotidiana del campus virtual de salud pública, creo que la experiencia, no quiero olvidarme de nadie, pero la experiencia que nosotros hemos tenido con María Senes, con Sofía Cortés, con Kiara, un gusto verte por acá, Kiara, no sé si Sofía está por ahí, con Imán, que está terminando su pasantía hoy es, desde mi perspectiva, excelente. Excelente porque nos interpela, nos preguntan, nos obligan a discutir, nos obligan a aprender, enriquece la vida cotidiana de los equipos. Así que, y seguramente yo soy un supervisor complicado, un supervisor difícil, un supervisor que los hago estar saltando de un lado al otro, un supervisor en donde el multitasking está ahí dando vuelta todo el tiempo. Pero bueno, como les suelo decir, es una apuesta que abran distintas puertas para el aprendizaje y para la discusión posterior después. Creo que hay diferentes modalidades y todas han sido bastante buenas a mi gusto. Creo que la experiencia, por ejemplo, de Chiara y de Sofía, teniendo la oportunidad de hacer la experiencia en una oficina de país y articularla con la experiencia en Washington, creo que fue clave. Iman le ha tocado la experiencia de que estuvo con nosotros totalmente virtual. Empezábamos nuestras reuniones cotidianas en nuestro chat virtual del campus diciéndole buenas tardes por París, buenos días por Panamá. Teníamos ahí esa cotidianeidad que poco a poco nos fue acercando. Pero bueno, nos quedó pendiente con Iman la participación en los almuerzos de los viernes del campus virtual y que esperemos que en algún momento se pueda concretar. Pero yo quiero felicitarlas a cada una de ustedes, pero felicitar la experiencia, felicitar el proyecto y desde la perspectiva de nuestra organización hacer una apuesta grande por la continuidad de experiencias de este tipo que nos enriquecen mutuamente. Paso la palabra, porque si no, no pago.
Thank you, gracias. No un supervisor complicado, un supervisor interesante y entusiasmado, yo creo, como todos. Thank you. I know we're running short on time and I want to keep the time because I know you're all professionals and busy. I'm going to ask Imani to show us very briefly the LinkedIn page that she set up. And then I'm going to ask the panel if they want to have any closing remarks, because I had asked them about if they had any tips or on networking or any tips or their favorite part of working at PAHO. So we'll end with that afterwards. But Imani put this together. As I mentioned, networking is a key part of bringing you together for yourselves, for each other, and also if PAHO wants to reach out to you to let you know about opportunities. So Imani put this together. Go ahead, Imani.
Thank you, Karen. Sure. We have observed that we have a diversity of HRH interns from their origins to their pathways and backgrounds. And we really want to consolidate our relationship with between former interns and also with our supervisors. And this deserves to be shared in a network like a LinkedIn group. So here it is. 1 month ago, we decided to organize, more than 1 month ago, we decided to organize this webinar, but also to create this network. So I will join the link for you to, yes, in the chat for you to just click and join. This is an open group and you can just share your experiences. Also, if you notice some career opportunities in our field, you can share it and just share your experience with the HRH unit. And we can also chit chat a little bit on this group. It's gonna be great, especially in these times as we all working remotely and we don't have the opportunity to meet in person. It will be great to have those conversations on this group. So it looks like that.
Thank you, Imani. I appreciate that. And you're putting it in the chat how they can join, right? You've done that. Great. Thank you very much, Imani. And I know it's Sam, you have to leave. Do you have any parting words? And then we'll have some comments from the others and we'll wrap it up after that.
Yeah, I would just echo what everyone has said. And I thank you so much for this opportunity. It's so refreshing to see everybody again. And I benefited so much from my experience with PAHO. So thank you. And I look forward to staying in touch with everyone. I look forward to joining the LinkedIn page.
Great. Thank you, Sam. And
Thanks.
please, everyone else, stay. Sam has to go on to another meeting. Ignacio, let's go down to Argentina and see if you have any final words.
Final words. Thank you very, very much to the Human Resource for Health of PAHO that made my stance in DC magnificent. And my advice for the new interns is especially to explore the organization. Just don't stay where you go, unless that's the only objective that you have. But PAHO has got lots to offer. Explore, get to meet lots of people. I love to see lots of faces that I met here, there when I went to DC, and that I kept in touch. And we are. I think that we are weird. Not everybody likes public health. It's a pandemic also, and we are weird. And this is a very nice place to get to meet with people that has our same interests. Not very easy to find. So thank you very, very much.
Thank you, Ignacio. Now we'll recruit for weird people, I guess, huh? Thanks for your comments. And now on to Chiara.
Sure. Thank you, Karen. I also wanted to thank everybody for the great experience I had. And estoy de acuerdo con Karen. Gabriel, usted no es un supervisor difícil de ninguna manera. My Spanish is a little rusty since PAHO, but yes, overall, I think that the team atmosphere at the virtual campus and at Human Resources for Health was the best thing of the internship for sure. Just so much support, both professional and personal support. Amazing supervisors, amazing people I got to work with and interact with. I was so lucky that my role allowed me to connect with many different people interested in working on different courses. And so I felt like that it was a very creative and fun environment where I made long-lasting friendships and a great network that is definitely the one thing that I would advise everybody working at PAHO to really invest time on, build those relationships, because they really do pay off in the end. And as Ignacio said as well, try to get your feet wet in as many different tasks as possible, because PAHO is a huge organization. It offers all those opportunities, and any kind of involvement in small tasks could benefit your career. It's great to ask, because the people working with you are that nice that they will really let you kind of organize your internship and let you try different things, even if they're not part of your formal curriculum. So thank you, everybody. Thank you, Gabriel. Thank you, Karen. And thank you, everybody that I had the pleasure to work with or interact with.
Thank you, Chiara. Thank you, Chiara. Now on to Neri, and then stay and we'll just have a wrap up after that. Neri?
I thank you, Karen. Thank you, Sylvia. That was my advisor. Thank you, Ana Amélia. And Kim is not here, but she was a very important friend that lasts until now. And it was from PAHO. Also, Jose was a very important person.
She joined us.
For me. Oh, okay, that's great.
Okay.
And I think one of the best things at PAHO was those relationship, friendships that we got, and it lasting until now. PAHO helped me to fulfill a dream that I had in my past, that was to be a diplomat. I also prepared myself to be a diplomat, but life changed and I couldn't do that. But when I went to PAHO, I kind of fulfilled that, being in contact with diversity, with many languages, with many histories, stories, different background. And I think that was amazing for me. And I felt like a health diplomat. And that was really important for me. And one advice that I could give to people that want to be a professional or want to be at PAHO, intern at PAHO, I would say then to try as much as possible to expose yourself to diversity, because diversity give you visions to develop, to grow and to change. And I think we need professionals with that views. Thank you.
Thank you, Nanny. Thank you. And I want to say when we started the program way back when, we were human resources for health and building capacity for human resources for health. And so that's what this program is. And it's really a pleasure and a joy to see the capable human resources for health that you are, that are out there. I really want to say thank you to everyone that's here today. Thank you to the coordinating team that helped put this together. Thank you to the PAHO staff, the supervisors and other staff, and Ana Maria Paulina, the former staff that have been very supportive in the program. And Andrea Cabral, one of the interns who did the survey. And obviously, again, to the interns, the former interns who have really supported the program and been a wonderful representation, ambassador of the program for us. We hope that you'll stay in touch.
Can
with
I
us.
say something, Karen?
Yes, yes. And then I want to wrap it up, but go ahead, Sabrina, please.
Since you are doing the thank yous, I want to thank you guys and the committee team for putting together this network. I know it's something that you wanted to do for many years, and now it's coming to reality. And I think all of us former interns, we have a lot to benefit from this just by being here today and listening to each other, and the paths that we take in that also help us in thinking about what paths can we pursue, what things can we get involved with based on the experiences that we hear. So I really want to thank you and the team that put this together, and also you and Sylvia for my own experiences at PAHO, which led me to everything that I have done after my internship. So thank you very much.
Thank you, Sabrina. I appreciate that. And it's true, if there is going to be a network, it would be you all really making it happen and staying connected. So I hope you will do that. And Sabrina, I saw you already entered your introduction on the LinkedIn. So thanks for doing that. And again, thanks to all of you. And I wanted to close with an image. And I was thinking, what would be a nice image? And I was looking at the internet, and then I thought, I don't need to do that because we have a beautiful live image that we can show you. And the value and the benefit of the virtual internship is that one of our virtual interns this semester is Imane Zidi, who is joining us from none other than, well, I don't even need to say the city. I think you can show it, Imane.
Okay.
Take a look at her view.
Okay.
We go up a little. Can you see where she's coming from? Paris. Just shows the Imane. When we have our meetings on Thursday mornings, I ask her every time to show me that view. It's just beautiful. But it also shows the global aspect of what we do and the global network that you have here right with you. So I hope you'll take advantage of that. Please stay in touch with us and with each other. And I will see you on LinkedIn. Thank you again to everyone.
Thank you.
Thank you.
Thank you.
Bye.
Bye-bye, everyone. Keep
Bye.
safe. Bye.
Thank you all.
Nice to see you guys.
We'll be in touch.